This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Another thing that was really surprising and really kind of a cool finding was the things that patients want and that they say would help them to access the system better are very similar across commercial and Medicaid populations, mainly that they were interested in financial support services, housing support, food programs, and again, transportation. So these solutions that patients are wanting, both commercial and Medicaid populations feel that those solutions would be really helpful for accessing the system.
Welcome to Sg2 Perspectives. I am your host for today's episode, Jayme Zage. I'm joined by my colleagues from the Vizient Research Institute, Erika Johnson and Victoria Beal, to talk about their research study that focused on the consumer needs aspect of access barriers. You will find the insights they have to share not only interesting, but also thought-provoking. And I hope they help you find innovative solutions to some of our biggest access challenges. Erika and Victoria, thank you for being with me today.
Thanks for having us.
Why don't we start with just a little bit of background describing the study and tell us why you decided to do this study in particular?
Sure, Jayme. We really appreciate the opportunity to share with you some of our research findings. And it's important to set a bit of context as to why we chose to focus in on consumer perspectives related to access barriers. The Vizient Research Institute annual economic research study last year focused on health disparities and really trying to understand how health disparities are contributing to variations in care across different patient populations. The way that we went about this research was we focused in on two patient populations. We compared a more advantaged population, which we defined as a commercial population, and looked at variations in access and treatment to a more vulnerable patient population, which we defined as those patients with Medicaid insurance. What we found was significant gaps in access and treatment between these populations, and really wanting to understand what we could do to improve that. We know health systems have, for a number of years, been focused on how to reduce health disparities. Everybody has different initiatives going on within their health systems or across their community to really focus on reducing health disparities. But the question is, are we really moving the needle? Are we having an impact on truly reducing those health disparities? And from our research, we would say that there's still a lot of opportunity here. Where we thought we could provide some unique insights was trying to understand from a patient perspective, what are the barriers to accessing care? What can we do as health systems from a patient perspective to reduce those barriers and make getting into our health systems easier from a patient perspective? To understand the patient's perspective, we went about conducting a national consumer survey with both Medicaid and commercial patients, partnering with NORC at the University of Chicago. We actually engaged over 1,000 participants, both Medicaid and commercial, to provide their perspective to us. Specifically, the survey asked different questions, but we really focused on 4 aspects to gain insights from our consumers. One was around what factors are influencing consumers' decision to either seek or avoid healthcare. The second question was really around focusing on how comfortable are patients with navigating our healthcare system today. A third component of the study was what are patients' experiences interacting with our health providers and our health systems today. And then fourth, from a patient's perspective, what could health systems do to improve their experience? After our survey was conducted, we followed up with focus groups. We had 4 focus groups, 2 with a commercial population and 2 with Medicaid populations, to dive deeper in terms of the details around their experiences, access barriers and challenges, and how as health systems we can address those and improve those for patients.
Thank you for that amazing sort of setup of why we did it, what it looked like, the questions we were asking. That's so important when we're using data to ask the right questions. Victoria, what were some of the key findings in the outcome of the study as you moved through both the data piece and the focus group piece?
One of the first areas we wanted to hone in on to understand was what was causing patients to miss appointments or choose to delay necessary care. For Medicaid patients, when we asked them what their primary reasons were, they identified the social determinants of health related issues. Particularly transportation was a big issue, with almost 40% of Medicaid patients identifying that as one of their primary reasons for missing appointments. For commercial population, cost was the primary barrier for why they were choosing to miss or delay an appointment. And that really came up as a key theme in focus groups as well, where commercial patients were weighing whether or not they thought that the care that they'd receive was worth the cost that they would incur from going in to see the provider. Another interesting finding was that Medicaid patients also report feeling less confident knowing where to go for care and with how to manage their care after they've seen a provider. We have about 40% of Medicaid patients saying that they do not feel confident knowing where to go next for medical care or how to manage their condition following a visit, compared to only about 25% of the commercial population. Medicaid patients also were less likely to feel included in their care decisions, listened to, and comfortable asking questions of their providers. Medicaid patients just feel less comfortable navigating the system than their commercial counterparts.
You mentioned the transportation not being a surprising finding. Was there anything that was surprising?
Yeah, for me, the most surprising thing, or maybe a realization through this research, was that more vulnerable patient populations are not trying to avoid the healthcare system. From our focus group discussion, some of them are aggressively trying to seek care, but they're struggling given the various barriers that are in place, preventing them from accessing our system, whether that be their insurance coverage, provider availability, long wait times that we hear in terms of trying to access providers, or even where we're located. Some of our current resources aren't aligned in close proximity to where some of these vulnerable patients reside. And so they struggle to get to the healthcare systems. That was really a key finding for us, was the realization that vulnerable patients are not trying to avoid the healthcare system. In fact, they are trying to seek care, but we've created barriers that are preventing them. And what was really interesting, Victoria can weigh in here in terms of the focus groups, is that some of these Medicaid and vulnerable patient populations have gotten pretty savvy in terms of trying to do workarounds within our health system to be able to access care. We heard directly from these focus group patients that they have learned to use the ED as an easy way to get their referral. It's not that their needs are urgent or emergent, but they know when they show up in the emergency department, they will get the referral that they want and need that day, rather than waiting maybe 4 to 6 months to get into a primary care doctor to get the referral and then having to wait another 4 to 6 months to actually get into the specialist that they need to see. That was one of the key surprising findings from the research. Victoria, would you have anything to add from your perspective?
Yes, I think another thing that was really surprising and really kind of a cool finding was the things that patients want and that they say would help them to access the system better are very similar across commercial and Medicaid populations. Medicaid population, they were much more likely to rate social determinants of health resources as highly important or important for them, mainly that they were interested in financial support services, housing support, food programs, and again, transportation, which makes sense. But what was interesting is that the commercial population, a fifth to a third also were really interested in those services and said that those were important for them to be able to access care. And then also with care navigators, 50% of Medicaid respondents said that access to better care navigation and care navigators would help them access the system and navigate systems better. 40% of commercial patients also felt that resource would be really helpful for them in accessing the system. So these solutions that patients are wanting, both commercial and Medicaid populations feel that those solutions would be really helpful for accessing the system.
As I read the draft of the paper that you all shared with me, one of the data points that was a little bit surprising to me, and it fell in the middle of why they missed appointments, had to do with the lack of appointment reminders. What was striking to me is there was quite a differential between the commercial and the Medicaid population, how they were reminded or that they were reminded about appointments. Was that something that they dug into at all in the focus group?
I wonder if it's connected to just more touch points with the system helps patients feel more comfortable. Those appointment reminders could be serving as a bridge to keep patients aware, especially with long wait times, that their appointment's coming up.
Well, I think one of the other aspects that was identified with the more vulnerable patient populations was in care navigation and case management and care management. And a lot of times when you have regular interactions with a case manager or even a clinical social worker or community health worker to help, that regular interaction helps to remind them of their appointments. And so if they don't have regular communication from that perspective, I think that could be why we were seeing a much higher proportion of Medicaid patients saying they were struggling with the lack of appointments reminders.
Lots of great insights. I really appreciate you sharing the surprising findings. As we think about our providers across the country, the health systems, even physician offices, whoever you want to be targeting here, how can these health systems use these insights that you're sharing as a way to actually reduce the access barriers, especially for those vulnerable patient populations?
One of the key findings that would elicit strategies for health systems to improve access is really looking at improving access, but earlier on in the course of care, really focusing on the upstream access to care as being critically important. And as we've found with the more vulnerable patient populations, particularly chronically ill, and actually this can be said for both commercially insured as well as Medicaid patients, the earlier that we can improve access in the course of care is really going to have a dramatic impact on the downstream impact in terms of their outcomes and the overall cost of care. From these findings, if there's ways in which our health system can really address these barriers to improve the earlier access in terms of managing their conditions before their conditions exacerbate is really going to be critical, improving the quality of care and ultimately lowering the cost of care for these patients. What's really critical is for providers to really focusing on the right care in the right place at the right time to really be effective in improving access for our more vulnerable patient populations.
I think it's also really crucial for health systems to design their system of care around what their patients need and what their preferences are and what would make it more accessible for them to access the care that they need to manage their health. Looking at different ways to support patients, such as expanding care navigation, which was really crucial. The healthcare systems are complicated, and for patients to be able to access, they need additional support. And then also partnering with community resources to provide those social support services that increase patients' ability to access care as well. Designing this system that supports patients is not only good for better quality of care, but also to try to reduce that unnecessary utilization and the higher cost of care downstream.
I think you bring up some really good points, and Veronica in particular, knowing the patient where they are. I heard an interesting story recently where there was a patient that was missing appointments, and they'd recently been put on oxygen, and they lived on the 4th floor of a walk-up. And the oxygen tank that they had been given was one of the big ones. Just even understanding that that was the barrier, that's where patient navigation comes in, those care coordinators to say, why are you missing this appointment? It's like, well, because I can't get my oxygen tank up and down the stairs. And so getting her one that was portable allowed her to be able to get to appointments. Sometimes it can be as simple a solution as something like that. That's a real powerful insight to really know who those customers are who are missing appointments and really dig in with them.
Yeah, Jayme, I think one of the other things that we point out in our research publication that's actually going to be hopefully released in the next couple of weeks to our Vizient Sg2 members is really looking at different types of delivery mechanisms to a more vulnerable patient population, looking at ways that they can leverage virtual care so that they can reduce any transportation issues or their proximity to a provider, looking at implementing different types of virtual strategies. We found that was actually favorable for even a more vulnerable patient population where they were interested in being able to access virtual care. And in fact, found that a higher proportion of Medicaid patients were actually accessing care virtually compared to a commercial population through our research findings. Looking at different alternative methods to improve access through virtual care or other types of delivery mechanisms is also critically important.
As we think about the next steps on this, what would you advise our health systems do first? What's the one piece of advice that you would give them on how to start to move forward with increasing access, especially in the vulnerable patient population?
I think measuring what their patient population needs and what the biggest barriers in their patient population are is really crucial before deciding on those next steps. And from there, move on to those actionable, here's where the gap is in access. And this is the strategy that would work for our patients.
Victoria's spot on in terms of understanding your patient population and what their specific barriers to access. And that really was the whole intent of this research, was to understand from a patient's perspective, what are those barriers to access? We have some assumptions as health providers or health systems in terms of what their barriers are, but are they barriers for them? And making sure that strategies that we implement are truly going to be effective in reducing those barriers. The other thing that health systems could also do is really think about ways that they could partner possibly with community partners partners to address some of these issues. So rather than going it alone or thinking that they need to only focus within themselves in terms of how they could reduce these barriers, there are examples, but more opportunity to really collaborate with other partners to work as a team to address reducing barriers in the community.
That's a great thought, Erika, to end our session on today. Thank you, Erika and Victoria, for being with me today. And thank you, as always, to our listeners for tuning in to this episode of Sg2 Perspectives.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.